Breast cancer is the most common cancer among American women, except for skin cancers, and it is the second leading cause of cancer death in women, and not just younger women. In fact, a recent study done by the National Cancer Institute showed that the median age of a woman at the time of breast cancer diagnosis was 61 years old. Here to talk with us about breast cancer is Patti Dye, Breast Health Nurse Navigator with the Ann Baroco Center at Sacred Heart Hospital. Patti, thanks for being here. Now, you got to explain the title. That's one I haven't seen before. Tell us, what's the Navigator? Tell us a little bit about that.
All right. About 20 years ago, Dr. Harold Freeman, who was a oncologist up in New York City, realized that there was a tremendous need for patients who were diagnosed or received a diagnosis of breast cancer to have basically someone hold their hand, because it is as you can well imagine, a very fear-producing diagnosis, and with medical treatment nowadays, especially nowadays, even more than 20 years ago, there's just a need for patients to have a guider or a navigator through the system of healthcare. Patients who are facing this diagnosis.
Well, that's a great way to look at it, and be there with somebody. Well, I understand that in women in their 30s, the chance of getting breast cancer is like 1 in 233, but it goes up to 1 in 8 by the time a woman reaches 85. Why is that change?
There's a number of reasons. One, we don't really know. That's one of the problems with cancer, breast cancers, is we don't really know what causes them. We can come up with some ideas, but as far as the increase at age of diagnosis, when we're younger, we have less environmental exposures. We haven't had the exposure of estrogen on the breast tissue that we have as we age. Many cancers, actually, other than, of course, the childhood cancers, are, we just see them more in older populations. So it's not unusual, but with breast cancer, probably environmental, possibly some genetic components, possibly, and again, the influence of estrogen on the breast tissue over all those years.
Well, let's talk about some of these known and possible risks for postmenopausal women. Talk about like hormone replacement therapy, for example.
For a number of years back, probably 10 to 15 years ago, there was a big push for women to be medicated with postmenopausally with hormone replacement. It was thought at that time that it did help with heart disease, helped decrease the risk of stroke, helped with bone density, helped with some urinary problems. After studies were done, the Women's Health Initiative came out, it became clear that it did not have the benefits that they thought it had. In fact, it increased the risk for some women to develop breast cancer, particularly, as well as sometimes heart disease and strokes, what they were trying to prevent. So they realized there should not be this big push for all women to be on hormone replacement. Now, that's not to say there's not benefits to it for a specific population of women, women who have very low bone density, who have urinary problems, who have major issues with quality of life, hot flashes, etc. They can benefit from short-term hormone replacement, and that's the key. What they're finding now is the minimum amount for the shortest amount of time.
So is this a conversation they should be having with their primary care physician? Say, I'm aware that there are some links, and let's talk about what I'm taking.
Right, and that's such a good point, Jeff, is that every woman should be having conversations with her own physician, not magazines are great, everything's great, but it's not pertinent to you as a person because you don't know what, or those magazines don't address the problems that you specifically have. So,
right,
yes.
and prevention is key.
Well, now prevention, unfortunately, with breast cancer, I wish I could say we could prevent it. Right now we don't know what causes it specifically, so we in breast cancer don't necessarily talk about prevention as such. We talk about early detection. That is still the best thing we have to offer women and men, actually, is early detection of breast cancer.
Well, as we were talking about, the chances of getting this increase with age.
Right.
Are there also changes in recommendations for mammograms
well,
or other type of?
You probably are aware, and I'm sure a number of our viewers are aware, that there was quite a large amount of information disseminated not long ago by the United States Task Force on breast screening, and was saying that women didn't need to start their screenings until they were 50 and should stop around 74. Actually, the American College of Radiology, American College of Surgeons, American Cancer Society are still maintaining that the benefits to patients is having a mammogram starting at age 40, having a yearly mammogram. You can have what's called a baseline or initial mammogram somewhere between 35 and 40, and then starting at 40, having a yearly screening mammogram. So there's really not an age, being older doesn't increase the surveillance, but it's probably more important as we get older because of how the rates go up.
And they should continue this throughout their life?
Yes.
Okay.
Yes.
Well, what about treatment in the unfortunate case that something is detected? Hopefully it's been detected very early.
Yeah.
But do treatment options and does that vary for older women?
It does not vary specifically for older women versus younger women who are diagnosed. It varies what type of breast cancer is diagnosed. Breast cancer is like most other cancers. It's not a one-dimensional or one type of disease. There are several types of breast cancers. And the types of breast cancers we see in younger women, unfortunately, tend to be more aggressive. So perhaps their mode of treatment or the chemotherapy agents used might be a little bit different. But that's more based on the type of cancer they have. As we get older, we can actually see sometimes better results because of the types of cancers that are diagnosed in older women.
Well, can let's say someone has chronic medical conditions or takes a lot of medicine just for other reasons, can this complicate treatment?
It can complicate treatment, particularly patients who have any kind of heart issues, because some of the chemotherapy regimens or drugs that are used in the treatment of breast cancers can be very difficult on the heart and can cause some toxicity for the heart. So not that they shouldn't take it, but the oncologist will definitely monitor their heart function very well during any treatment or thoughts of any treatment pre-treatment to make sure that their heart is not damaged or will not be damaged with the treatments.
Do you see that older women have a different perspective or outlook on treatment? Do they think this is something they've got to be more aggressive with, or do they say, well, I'm older,
It varies tremendously. In fact, we're talking about this at our center. Sometimes what happens is, unfortunately, it seems to be patients that we see who are older. And I don't know if this is just what we call anecdotal, it just happens to us, but often their cancers tend to be more advanced because they haven't been in the mode of having mammograms. They're not as comfortable with their bodies sometimes. And again, this varies so much from person to person, but they don't seem to have a discrepancy of how they want to have it treated.
Well, that's great information, and we've been showing your phone number with the topic.
Great.
And thank you for being here. We really appreciate it.
It was a pleasure. Thank you.